Hi, this is Robert Peltier, Chief Medical Officer at North Oaks in Hammond, Louisiana. Wanted to give you an update on COVID. We've certainly seen a surge in the last few weeks, so let's start with the numbers. Unfortunately, worldwide, we are over 15 million cases. In the United States, probably even today, the 23rd of July in 2020, we will probably eclipse 4 million cases in the United States. In Louisiana, we have over 100,000, or we will by the end of the day, have over 100,000 confirmed cases. And in Tangipahoa Parish, we're up to 2,536 cases. We've seen a significant change even in the past few weeks. From last month, on the 25th of June, our bed count was only 631 hospitalized patients. We are now up to 1,581 patients, including over a doubling of our ventilated patients, moving from 77 to 188. In Tangipahoa Parish, we continue to see a rise, and that's really been over the past 2 weeks. Even 2 weeks ago, in a conversation that I had a call with the governor and other chief medical officers from around the state, I was happy to report that Region 9 was doing really well, and at that time we had 5 hospitalized patients. Today, unfortunately, we are over 40, with many of those patients being in the intensive care units, and unfortunately some on ventilators. And we have lost a few patients this past week to this dreadful disease. Our positivity rate, or our percent positivity for testing, has gone up dramatically in the past few weeks, unfortunately. In Tangipahoa, during the last week of June of this year, we were running a positivity rate, and that's the percent of people that take a test that turn out positive, to be a little over 10%. By the next week, it was 13.6%, and last week it was 20.1%. And subsequently, we see the hospitalizations follow. It's directly impactful on how many people get hospitalized. In addition to the fact that testing has grown dramatically since we last talked, that percent positive represents a large amount of patients that are presenting to our facility needing care. The difference has been that we are also back treating all the other patients. So it's made our resources for our hospital a little taxed at this time. We're able to handle it, and we have some capacity, but it's going to depend on you to go back to the basics, to be able to flatten that curve so that we don't get overwhelmed at your local healthcare facility. So let's talk about getting back to the basics. Remember what the basics are, and the basics are staying away from others, or keeping our distance. The best thing to do is, when you can, stay at home. We've forgotten that. We've moved to phase 1 and phase 2, but still the recommendation is, if you don't have to get out, don't get out. Go back to grocery shopping every 2 weeks. Don't do it every week or every couple of days. I think we've become all lax, including myself, on some of those recommendations, and it's important that we go back to them. Hand washing continues to be a solid recommendation. We know that when we touch our eyes, touch our face, and touch other humans especially, the chance of transmission between those people goes up dramatically. That 6 feet is still a good recommendation when you do have to get out. Keep your distance. No matter where you are, we're all going back to work, and those interactions with our fellow coworkers can still be managed by keeping your distance. Of course, we all know that a couple of weeks ago, the governor did a universal masking mandate. So let's address masking, which for some reason has become controversial and really shouldn't be. Whether you are obligated to mask or not, it's just a good idea. Over 30 studies have shown that the mask, in addition to what we've talked about before, which is protecting others if you would have it not know, does have protection for the individual wearing it. We know that from over 30 different papers that you can see on the CDC website. We also know from Brigham and Women's study that when they went to universal masking at their hospital, we saw the number of their healthcare people not getting sick. And so it does make a significant difference. There's a lot of rumors out there as well about a mask causing problems. So think about it logically. For a century, physicians, nurses, surgical scrub techs have done millions and millions of surgical procedures wearing a mask for hours on end. We would certainly know by now if a mask was detrimental to their health. It's just not true. Whenever you see something on the internet that smells a little bit funny, research it, look at it, make up your own mind for yourself. Facebook is a great place to share information, but some of the information you have to take it with a grain of salt. So do your own investigation, and when it doesn't sound right, question it and look it up yourself. Masking does make a difference, and we know that from another big study or a modeling effect in the Institute for Healthcare Metrics and Evaluation, which is the University of Washington's website, which we've talked about on previous videos, is the website that the White House had been using for modeling of the virus. They now have enough information in their computer database to show us that the effects of masking versus not masking and universal masking. We know that from the metrics that they got from other countries that implemented or places in the United States, and they're able to predict that. From that modeling, we know that by October 1st, we can save about 400 lives in Louisiana just by doing this universal masking. It's not detrimental. Yes, it's hot outside. I understand nobody likes wearing the mask, but I keep my mask with me at all times. We wear it throughout the hospital. I wear it when I go to the grocery store. I wear it when I'm not alone or just with my immediate family at home. Otherwise, the mask goes on. Doesn't have to be a special mask. It could be a simple cloth mask like this one my wife got me off the internet. Certainly here we have some disposable masks that we use, but it's not necessary, and they're widely available. So please, if you can mask, please mask. Be a citizen of the community by supporting both the hospital here, but your fellow citizens of Tangipahoa Parish by wearing that mask. Again, very little risk. As always, we continue to have people calling for a number of reasons here. So let me address a few of the questions that are common to us. The first one is testing. How do I get tested? When should I get tested? And those kinds of questions. There are multiple venues for you to get tests nowadays, both from physician offices to coming here to North Oaks with a doctor's order when they feel like they need a testing, to state testing. And I would encourage everyone to go to the Tangipahoa Parish government website. They have a list of the state testing, which is free. It's drive up. You get your results in a few days, whether you're symptomatic or asymptomatic. I would recommend if you're going because you've had a close contact exposure. Close contact is defined by being around someone who is known COVID positive within 6 feet for 15 minutes. If you've had that kind of exposure, I would suggest you do get tested. I would not do it the day after that exposure. In fact, I'd wait 4 to 5 days because that's the earliest that you would have a positive test if you did have a significant exposure. The other question that we get quite frequently is, if I have the virus, when can I get back to interacting with other people? And there's just a simple rule, it's 10 and 3. Just remember 10 and 3. So it should be 10 days after you've been diagnosed or had a positive test, the day of your test, plus at least 3 days without symptoms. Those symptoms being fever, significant cough or shortness of breath. As long as your cough is dissipating, people will continue to have a little bit of a cough. But if you're symptomatic, at least 3 days you need to be asymptomatic prior to that. If you didn't have symptoms at all, the rule is 10 days from a positive test. So obviously you can't use symptoms as a guide, just 10 days. We recently got something from the Board of Medical Examiners saying that the new recommendation for people that had severe disease would be 20 days. So that is a recommendation. And talk to your doctor of whether you should be listed as severe disease and a 20-day exclusion or self-isolation from others. I hope this has been informational to you. We are going to reinstitute doing these video chats that we have, and we'll at least be doing them weekly while we have this current uptick in cases. Please submit any questions on Facebook or Twitter to our North Oaks sites, and we'd be glad to try to answer those pertinent questions that can help you out. And again, if you have symptoms and you're curious, you can still call our hotline at 985-230-2778. Stay safe, and thanks for listening.